Today, we're stepping onto a battlefield, one that's been raging for thousands of years, a conflict that has literally shaped the history of surgery as we know it. We're talking about the invisible war against surgical infection, a fight that started long before we even knew who the enemy was. So let's dive it in.
So let me ask you a question. If you had to guess, what do you think has been the single greatest danger for a patient on the operating table throughout all of history? Your mind probably jumps to things like bleeding out or just the unbelievable pain of it all. But for centuries, the real killer wasn't the surgeon's knife. It was what happened after.
Yep, infection. That silent, invisible invader that could turn a perfectly successful operation into a total tragedy. For most of human history, a surgeon's biggest challenge wasn't just fixing the body, but somehow protecting it from an enemy they couldn't even see. This is the story of that fight.
To really get a handle on the modern battle, we have to roll the clock way back. Because long before we had microscopes or labs, ancient surgeons knew something was going terribly wrong. They saw the devastating consequences of infection, even if they had no idea what was actually causing it.
And what's so fascinating is you can see these early attempts to fight back. The Egyptians, who were masters of preventing decay and mummification, tried to apply that knowledge to living patients. The Greeks, with the famous Hippocrates, were washing out wounds with wine and vinegar. They didn't know why it worked, but they knew it helped. And then you have the Roman physician Galen, who noticed that if you drained the pus from a wound, the patient often got better. They were all on the right track, fighting the symptoms, but the root cause, that remained a complete mystery.
And then, the 19th century happened. This was the era where the invisible enemy was finally dragged into the light. It was all thanks to a series of brilliant medical detectives, each one building on the last, who would piece together the clues and completely change medicine forever.
It's like watching a relay race of discovery. You have Semmelweis in the 1840s, who tragically figured out that doctors were carrying something deadly from the autopsy room to the maternity ward, and that just washing their hands could stop it. Then, Louis Pasteur comes along and provides the smoking gun with his germ theory, proving that tiny living organisms were the real culprits. Joseph Lister hears about this and has a light bulb moment, applying the theory directly to surgery with antiseptics. And finally, Robert Koch gives us the official rulebook, the scientific method to prove exactly which germ causes which disease.
And Koch's postulates were the scientific mic drop. He laid out this incredibly clear set of rules. You have to find the microbe in every sick animal, grow it in a lab, show that it causes the same disease in a healthy animal, and then find the exact same microbe in that new sick animal. It was rigorous, it was brilliant, and it turned germ theory into undeniable fact.
So all these discoveries led to two different but equally important battle plans. First was Lister's antiseptic technique. Think of this like fighting invaders who are already inside your castle walls. You're using chemicals to kill the germs that are there. But right after that came the aseptic technique. This is about fortifying the castle so the invaders can't get in at all. We're talking sterile instruments, sterile gowns, sterile everything. Prevention, not just reaction.
Just as surgery was getting really good at fortifying that castle, a brand new weapon appeared in the 20th century. This wasn't just about surface germs anymore. This was the so-called magic bullet that could hunt down and destroy infection deep inside the human body.
You've probably heard the almost mythical story of Alexander Fleming and the moldy petri dish, but the real heroes who turned that happy accident into a world-changing medicine were Florey and Chain. They figured out how to purify penicillin and produce it on a massive scale right in the middle of World War II. For the first time ever, surgeons had a weapon to fight infections from the inside out.
And just look at the results. I mean, wow, this chart shows what happens in a contaminated surgery, like when an appendix bursts. Before antibiotics, you had up to a 1 in 5 chance of getting a serious infection. But then, look at that second bar. By giving antibiotics before the surgery prophylactically, that risk plummets to just 6%. This was an absolute game changer, and it made so many of the complex surgeries we take for granted today even possible.
But here's the thing about a war. The enemy doesn't just lie down and surrender. Just as we got these incredibly powerful new weapons, the microbes, they started to adapt. They started to evolve. And that's what defines the modern fight against surgical infection.
Now, here's one of the most surprising twists. We spend all this time thinking about germs from the outside world, right? That's exogenous infection. But in today's super sterile hospitals, that's actually the less common problem. The vast majority of surgical infections today are endogenous, meaning they come from the patient's own body. In a way, it's a sign of how good we've gotten.
We've locked the castle gate so well that the main threat is now the one that was hiding inside all along. The call is coming from inside the house.
So, let's meet some of the key players in this modern war. First up in our rogues gallery, Staphylococcus aureus. This guy is a classic opportunist.
It actually lives harmlessly in the nose and throat of a decent chunk of the population. But if it gets a chance, like through a surgical cut, it can cause some really nasty pus-forming infections. But its real danger, its superpower, is its ability to evolve. It developed into MRSA, a superbug that's resistant to some of our most powerful antibiotics. MRSA became a global problem and forced hospitals to completely rethink how they screen for and contain infections.
Okay, next up is a different kind of enemy. This is a villain that, ironically, we often create with our own best weapons. Meet Clostridium difficile, or as it's better known, C. diff.
This is the great paradox of modern medicine. C. diff is a totally normal bacteria that lives in our gut. But when we hit a patient with broad-spectrum antibiotics, it's like carpet bombing the gut's ecosystem. All the good bacteria die off, but C. diff is tough. It survives, and with all its competition gone, it just takes over, causing a horrible, sometimes deadly intestinal infection. It's a sobering reminder of just how delicate that internal balance is.
So, all of this brings us to today. The modern surgical battlefield is incredibly complex. We're fighting on multiple fronts, using everything we've learned over the centuries. And a huge piece of the puzzle now is understanding that sometimes the most dangerous thing isn't the microbe itself, but our own body's reaction to it. Okay, this can sound a bit technical, but it's absolutely crucial. When the body faces a major infection, it can sometimes launch its defenses with such overwhelming force that the defense itself becomes the problem. This is called SARS. Now, when that massive inflammatory response is confirmed to be from an infection, we call it sepsis. And if things get so bad that the body's own friendly fire starts shutting down vital organs, that's severe sepsis. It is a true medical emergency.
And to fight that emergency, medical teams now have protocols like the Sepsis 6. It is a brilliant, simple, powerful checklist of things to do within the first hour of suspecting sepsis. The way to remember it is give 3, take 3. You give oxygen, IV antibiotics, and IV fluids. And you take blood cultures, lactate levels, and measure urine output. It's a clear, rapid-fire plan that absolutely saves lives by stopping that dangerous cascade in its tracks.
So when you put it all together, what does the modern fight look like? It's a beautiful synthesis of everything we've learned. The foundation is still that strict aseptic technique from the 19th century. It's the first and best line of defense. We pair that with the smart, judicial use of antibiotics, especially in high-risk surgeries. We have constant vigilance, always on the lookout for superbugs like MRSA. We have rapid response plans like the Sepsis 6, and as we all learned from COVID-19, the whole system has to be ready to adapt to brand new threats on a dime. We've come an incredible way, from washing wounds with wine to deploying rapid response teams for sepsis. The fight against surgical infection is a war we have been slowly, painstakingly winning. But it is a war that will never, ever be truly over. Our microbial enemies are clever, and they are evolving as we speak. So the final question isn't just about what we're doing today, but what comes next. As these microbes keep changing the rules, what will our next great breakthrough have to be to win the battles of tomorrow?